Now that we have described how to position the probe to obtain an optimal plane of scanning for assessment of the pleural space, we will demonstrate the correlation between the size and location of an effusion and where the probe should be positioned. In order to explain this point, we will again use the transverse view as obtained with a CT scan to help illustrate the concepts. As previously discussed, assessment of a pleural effusion in the supine ICU patient will be done mainly by scanning the lateral zone of the chest and the longitudinal plane. If the probe is placed at the upper boundary of the lateral zone, that is, in the anterior axillary line, fluid will be visualized in the ultrasound plane only if the effusion is massive. A less important effusion would be missed with such an anterior or ventral probe position on the chest. If the probe is placed in the middle of the lateral zone, that is, in the mid-axillary line, effusions that are large and moderate in size will be visualized. However, effusion of smaller size and more posteriorly located will not be visualized with such a probe position. When the transducer is positioned in the posterior axillary line, literally touching the bed, effusions that are large, medium, and small will all be visualized. However, very small posterior effusions could be missed in the supine patient. In these cases, one option to better scan the posterior aspect of the pleural space is to slightly roll the patient in a lateral decubitus position and place the transducer at or below the posterior axillary line with an upward angulation of the probe and ultrasound beam towards the center of the body. These small posterior effusions are said to be subposterior in location. To optimize visualization and tapping or drainage of small subposterior effusion, another option is to place the patient's lateral chest flush to the side of the bed mattress so that the probe can be easily positioned in this subposterior area. Care must be taken to adequately restrain the patient so as to avoid an accidental fall off the bed.